Know we're going to be talking about superbugs today. Can you just give us a brief introduction on what exactly are superbugs?
So superbugs are not a medical term or a medical class. They're a way of kind of denoting bacteria that have become resistant to multiple different classes of antibiotics, giving them kind of an additional power to infect and cause disease because there are limited to no countermeasures you can use against them because of the level of resistance they've evolved.
hmm And can you tell us what are the most effective steps healthcare institutions can take to combat the antibiotic resistance and reduce the spread of superbugs?
Well, the first thing that institutions need to do is recognize that these are a major problem and not just something that infectious disease doctors continually harp about, that they can really disrupt hospital operations in the form of causing outbreaks, in the form of additional protective equipment that's needed or personal protective equipment that's needed, in addition to making it very difficult for surgeries to occur if somebody is colonized with a drug resistant bacteria. All of that is really important to keep hospitals operating. So the first thing is they have to acknowledge that this isn't just a niche problem related to infectious disease priorities. It's something that can impact the entire hospital. And it is something that will affect length of stay, it will affect reimbursement. Certain hospital acquired infections that might occur could be penalized. The hospital could be penalized financially if those occur. So this is something they have to take seriously for multiple different reasons. So once they actually acknowledge it's a problem, they have to recognize that there are tools that are needed. Many hospitals don't adequately resource infection control and infectious disease departments where there's not enough personnel or people doing multiple jobs, one person doing multiple jobs. And the other thing is that they don't have tools, that there are many diagnostic tests that can be put in place in microbiology labs, very modern things that enable clinicians to understand what's going on much faster, to link people to the correct treatment, to understand there's a resistance problem at a very granular level. Those need to be implemented. Those need to be not kind of held back. They need to be part of the portfolio of equipment, portfolio of tools that are available to infectious disease doctors, infection control practitioners. And even it's even going kind of in the 21st century with whole genome sequencing to identify outbreaks faster. Things that don't look linked, maybe because they're on different floors, might actually be linked. And what you need to do is kind of embrace all of those tools and realize that preventing antimicrobial resistance, combating antimicrobial resistance goes hand in hand with good hospital infection control in a facility and makes patients safer and eventually will lead to, in the long term, a better and more successful healthcare facility.
Now we're going to speak a little bit more on the clinician side. How can clinicians best educate their patients on the risks of antibiotic resistance and ensure adherence to responsible antibiotic use?
I think you have to educate them starting with the very basics, having them understand why bacteria develop resistance, how they develop resistance, what antibiotics are capable of doing, and what they can't do. And that many infections are not going to be something that antibiotics are indicated for. And that there are other treatments, maybe antivirals or symptomatic treatments that could be used in lieu of antibiotics. So it's really about talking to patients about antibiotics being a specific treatment for a specific type of condition, not a solution for everything. And that there's a process that needs to be put in place in the clinician's mind and in the patient's mind when they're thinking about the use of an antibiotic, that they're not just some unlimited resource, and that using them, even if it might not cause adverse side effects in the patient, does cause adverse side effects in the bacteria that live in the patient. And that's something that people have to start to become accustomed to, that there's these cascading consequences of inappropriate use of antibiotics that you might not see in the next week or the next month or even the next year. But you have to think long term because antibiotics are very different than any other kind of medicine that we take. Your use of antibiotics can impact other people's use of antibiotics in the future. It can drive evolution of another species. And I think that's something that's very unique to the use of antibiotics. It's not quite appreciated. Antibiotics are not like taking an ibuprofen. They have a whole different mechanism of action and a whole different impact on your body and all the bacteria that live in your body. And I think that's what has to be kind of understood. that it's not something that you should just take in the manner that you take a pain medication, for example, that this is something that really has to be thought through. And for too long, people kind of thought of antibiotics as something that were just like everything else and didn't think about the consequences. And that's more the general public and some clinicians, not people like Alexander Fleming, the discoverer of penicillin, who in his Nobel Prize speech warned of exactly this decades ago. And I think that's what people don't really get, that they're very short, they're looking at a short time horizon. They're not thinking about the problem of antibiotic resistance, which might unfold over decades. They're thinking about that's not my problem. That's another problem that maybe the pharmaceutical companies will solve down the line with newer antibiotics. But we're in a situation where we have bad bugs and no drugs. It's very difficult to develop new antibiotics, and it is very costly to develop new antibiotics. So it is really important that we preserve the ones we have by using them judiciously when they're indicated and not using them when they're not indicated.
And can you tell us any recent advancements in treating these infections that clinicians should be aware of, maybe some that you have heard of or that you've used or seen, and how can they incorporate them into their practice?
There's a couple of things I would say. First is we're getting better at diagnosing infections and realizing that not everything that we once thought was a bacterial infection is a bacterial infection. So something might be caused by a virus like influenza or COVID or another virus, and you can direct that patient to specific antiviral therapy or symptomatic therapy. So diagnostics have become a major tool in antibiotic stewardship. Number two, we do have some new antibiotics that have been developed primarily to treat very resistant gram-negative drugs. So there are antibiotics like cefiderocol or imipenem relebactam or ceftolozane tazobactam or meropenem viberobactam or there's a whole host of them. There's a whole portfolio which if you're not keeping up to date on antibiotics, you might have forgotten or not noticed have been approved. So these are important things to get detailed on by your infectious disease doctor, by your infectious disease pharmacist, so you know what tools are available and for what in types of infection. So there has been some advance, but again, these are all kind of a limited pool, and there's already resistance developing to many of them. So there are those. So I would say diagnostics and new antibiotics are definitely happening, but not quite at the pace or in the manner that we need to kind of reverse these trends. And lastly, there are some very innovative things that people have been trying, something called bacteriophages, which are viruses that infect bacteria. And we're starting to see bacteriophage therapy be something that are being tried in infections of last resort. So there are phage therapy centers at the University of Pittsburgh, for example, where you can match your infection to a specific viral species, which can then be administered to you. And there's some limited success there as well. So there are people trying to push beyond antibiotics as well as trying to develop new antibiotics. So this is something that is a major issue. The United Nations has had a high-level meeting about it. It's become a priority for the world. And I think if we are to keep modern medicine functioning and advancing and organ transplantations and new cancer therapies, it's going to be antibiotics that facilitate that because infection is the major thing that we're trying to prevent in those vulnerable patients.
Mhm.